Yes. Let's say you accidentally changed your gender. So is there a way to reverse it? If a person who has changed their gender regrets it, can they revert the surgery back to the original? Our answer to this question is yes. In this video, we will discuss this topic a bit. Now, so why did we feel the need to talk about this topic? About 6 months ago, a topic like this was debated in the American Parliament. Years ago, when they were still children, decisions were made on their behalf by psychiatrists. Yes, it is decided that gender change is appropriate and that their future lives might be much better. Children who have their genders changed often complain in the Parliament about various issues. What kind of story is this? Look, in our country, you need to reach full maturity, complete your puberty, and have court decisions approved to change your gender. Of course, I am excluding intersex or ambiguous gender forms from this. This is a story about our fully matured patients who aim to change their gender in America. If a child is considered to belong to the opposite sex in terms of gender identity, they can change their gender at a young age with their family's approval, of course, after a series of psychiatric follow-ups and decisions by certain commissions. Actually, if you think about it, why do people change their gender? Because they feel like they belong to a different identity, the identity of the opposite sex. Is that correct? If so, theoretically, solving this problem at a young age when it is noticed can be extremely advantageous for the person's future life, but the reality is not entirely like that. Here's the thing. Someone who decides to change their gender starts to notice the feeling of belonging to the opposite sex around the age of 4 or 5. This shows itself in the playgroups around them, in the people they communicate with, in the clothes they wear, in their behaviors, etc. I come to the conclusion that I belong to the opposite sex at a very young age. Of course, at first I can't make sense of it. He is going through a time he is confused because he cannot make sense of it. He is having problems with his friends. He is having problems with his family. He can experience serious issues with his schoolwork. Then, after reaching a certain level of maturity, they fully realize what the situation is. After that, they apply to the court processes, as I mentioned abroad. If parents notice this early and get the support of a psychiatrist, they can request gender change surgery for their child at a young age. But it turns out that a significant number of people who underwent gender change at a young age expressed that the surgery was done to them by mistake and that they would not have belonged to the opposite sex if they had gone through a normal development process. And because of this, a number of lawsuits were filed against the healthcare system. Why did you operate on me, they asked. Now, when we think within this framework, it means that fluctuations can occur from time to time within sexual maturation. During this growth phase, a child can experience such fluctuations when they are unable to understand the difference between themselves and the opposite sex while discovering their own sexuality. Look, nowadays, people even struggle to understand the reasoning behind why a trans individual wants to transition to the opposite sex. Imagine this. Regardless of which gender you are, I imagine this for myself. You want to be with a woman. The sexual object in your mind is a female object. I come home, undress and look, and I have a vagina on my body. Now, I know exactly what I want, but my body definitely doesn't match it. This is a very clear distinction, and I know very clearly what I want here. Do I have a chance to change my brain? You can't change your brain. Your brain is like an electronic circuit made up of neurons. Since we don't even know which neuron exactly manages this, you have no chance of making a change related to your brain. In borderline cases, there are efforts to guide this with some psychotherapies and some phytotherapies for the individuals at the border. There are those who succeed, but dealing with this on the brain is extremely difficult. Since we can't change the brain, we change our bodies. But as I said, while people today find it extremely difficult to even understand the logic behind this, there are many uncertainties about how a child goes through turmoil. during the process of establishing their sexual identity and how they discover their own sexual identity. And at this stage, it is indeed true that our child has a gender identity disorder. Making a decision like, let's change your gender, can really cause significant problems. Maybe some people will object to this. So, what are the correct decisions? Yes, if the decision was made correctly, they are in the gender they desire throughout the process of becoming themselves. They make friends of the gender they desire, they complete their education within the gender they choose, they shape their family relationships accordingly. Yes, everything is perfect. But as I said, there is also a significant group who believe that the decision to undergo this surgery was wrong and that it was a huge mistake to make such a decision on their behalf because they were just children. Given this situation, it became necessary to make a video on this topic. From time to time, we hear things like this in our clinic. So, I want to change my gender, but if I regret it in the future, can it be reversed? Now, this is a very dangerous question. If the possibility of regretting this in the future is already on your mind, it means you are not ready for this surgery. So why do people fall into such confusion? There can be many reasons for this. It could really stem from the way they were raised, certain sexual traumas, societal impulses, societal pressures, peer pressure, drug use, the use of certain psychiatric medications, or some genuinely organic psychiatric disorders. All of these can mislead you. What happens in this case? It turns out that your request for gender change is not genuine. So, what should we do before deciding on this surgery? It is really necessary to go through a very thorough psychiatric follow-up process. And this period should not be confined to a narrow time frame because it is not impossible to reverse. In this video, we will explain how it can be done. However, the decision-making process needs to be calm and take a long time. We should not underestimate the fluctuations in childhood. And it's important to acknowledge that there are sexual behavior patterns, not just limited to male and female, but also those in between. The issue of sexual preference in this intermediate form can push a person towards the wrong decision, because maybe you want to stay in your current gender and live your sexual preference differently, rather than transitioning from female to male or male to female. There are fine nuances to these. It is necessary to think carefully and to get psychiatric support. Otherwise, we might make a mistake. After all, I think once a patient with a decision already made comes to me, regardless of the patient's psychiatric process, what I will do is clear. We can transform a penis into a vagina and a vagina into a penis, but it is extremely important to do this correctly. It is very, very important both from a moral standpoint and for your mental health. So you went through a wrong decision-making process somehow, or a decision was made on your behalf at a young age, and you had gender reassignment surgery. After growing up, you realized that this decision was wrong. So, what will be done at this stage? Is there a way to reverse it? Yes, it is reversible. Now, before we move on to the topic of reversal, we need to address this. How successful are gender reassignment surgeries? Look, the number of techniques for male to female gender reassignment surgery is much fewer compared to the techniques for female to male gender reassignment surgery. Why? Because in fact they are operated on by choosing one of a few methods that are well grounded and have a roughly established technique. The results are considered successful. In male to female transition surgery, especially with the technique we use and have published an article about, we can create all the details of the vagina. The small scars in the middle gradually disappear over time. Even if it never completely goes away, it reduces to a size that doesn't bother the eye. In fact, if desired, hair can be implanted over the stitches. Moreover, if desired, these stitches can be covered with skin-colored tattoos, making it extremely difficult for anyone to realize that it has been transformed from a penis to a vagina. But in female-to-male transition surgeries, the number of techniques is countless. The reason for this is that there isn't a fully established, widely accepted, and perfect method. Each method has its unique complications and problems. Therefore, It must be acknowledged that the surgery for transitioning from female to male is a bit more difficult and somewhat less advanced in terms of results. Along with this, a functional penis, complete with a glans and shaft, can be created. In fact, I recently came across something very beautiful that I now absolutely must include in the follow-up of my surgeries. When tattoos are applied to the penis with checkerboard patterns, the results are incredibly beautiful. I really liked it. We are constantly evolving. Of course, we are learning new things. But still, since they have transitioned from male to female, they are one step behind the other transformation surgery. One way or another, since we reconcile your brain with your body, we should see the results of both surgeries as satisfactory, because the patients are happy. So, how will the transformation be? Now, I think the most crucial point in the transformation is sensitivity. Can you have an orgasm after this surgery? Now, in the article we published, we can create a vagina from the penis using a flap made from the head, and shaft of the penis, allowing for the possibility of orgasm regardless of the method, whether it's from the intestine, penile inversion, or our method, it doesn't matter, if the sensitivity of the clitoral area has been sufficiently preserved. And you regret this surgery, or as I mentioned, if this surgery was done at a young age, you want to reverse this transformation. By preserving a clitoris-centered point, it is possible to completely remove the vagina created from hair, penis, or skin grafts, as in our method, eliminate the labia majora and minora, transform it into a penis, and organize the nerve endings in the clitoris to function as the sensation for the penis. What happens in this case? There is still a penis, the vagina is gone. We can create your facilities, and you can continue to have orgasms in the end. We have restored you to a male function. What are the problems here? The penis may remain constantly erect depending on the implant you have placed inside. Using inflatable implants, the penis can also be made to functionally rise and fall, urinary tract. According to the previous technique of constructing the urinary tract, you can urinate from the tip of the penis. You might also be able to urinate from the base of the penis. As I said, it may not be 100% reversal, but at least the removal of a genital vagina appearance and the emergence of a penis form, and the fact that you can achieve orgasm with this penis form, can to some extent mean that the reversal of the surgery has been successful. So what about the other method? You transitioned from female to male, but now think it was the wrong decision. So can a penis that has been created be turned back into a vagina? Yes. This can also be done because the closed gap between the bladder and the colon can be reopened, which is extremely difficult. It can be done. After creating a canal for a vagina, the existing tissue of your penis can be divided into two to form the labia on the left and right sides. Your urinary tract can then be reorganized accordingly, and a vagina can be created. However, there is a problem here. The clitoral area, which was used to create the penis from the vagina, is used for sensation. Its sensitivity must still be preserved so that we can create a new clitoris from this tissue. Both methods have a particular difficulty that we must not forget, which might be the most important issue. During the transition from male to female, we also remove the testicles. In the transition from female to male, the uterus and ovaries are also removed. In reversal surgeries, you will never have an ovary, testicle, or uterus again. What does this mean? Firstly, because you already lost your reproductive functions in the initial surgery, your reproductive functions will not return. Okay, what has been done for such a thing? What precautions could have been taken? One precaution could be this. Before your first surgery, men freezing their sperm and women preserving their eggs might not be something you're considering in terms of future parenthood or reversibility, but at least it could be beneficial for having a child in the future, and because these will not return in the reversal surgery. To change your gender back to its original state, you will not have reproductive functions Even if we reconstruct a vagina for you because you have a uterus, and even if you return to your sexual life and experience orgasms again, which can be achieved, you will not menstruate, have periods, or be able to give birth because you do not have a uterus. It's important not to forget these details. You can reverse your gender reassignment surgery, provided you remember that. You will not be able to regain your reproductive functions. As I said, small camouflages might be needed for the scars here. For many patients, the scar disappears and doesn't cause discomfort. For those whose scars don't disappear, skin-colored tattoos can be applied, hair can be transplanted, and it's possible to reduce it to levels that will not cause discomfort. If sensitivity was preserved in the first surgery, your focus can be restored again. This can be guaranteed, but as I said, the functions lost to death will not return. But gender reassignment is a very major surgery. It means that one individual ceases to exist and another individual comes into being. If we consider that a mistaken decision here can be reversed, then the sacrificed features are extremely acceptable. You might need to think that it's better than nothing. After all, even if some functions are lost, like reproductive functions, and even if small scars remain, knowing that there is a chance to reverse this massive transformation might bring some relief to our hearts. It could also be a beacon of hope for people who are victims in this matter. Please write your questions about this topic below. Follow the channel, because as you support us, I am considering developing this further. We are receiving extremely positive feedback from people. We realized that we are able to reach a much larger audience in some way. That's it. Thank you for listening. Take good care of yourselves.